presenters, we have the opportunity not only of covering an important topic through the perspectives and insights of sport and a good number of experts on this topic, but also to have the opportunity to conduct an exercise of a consultation, almost like a focus group on this topic, so that rather than just having a presentation of perspectives and then be satisfied with pretty much with that, we have the opportunity to reflect on these contributions, to appreciate their similarities and differences and the patterns that emerge in such a way that we can obtain some conclusions based on the variety and richness and depth of those perspectives. Not only to enhance our educational experience within this very important Chandigarh conference, where also the memory of Narendra Week is very much alive with us, but also have the opportunity to advance the universal literature by contributing to that on the basis of this experience. So as you know from the plans that were formulated, that we hope that in addition to the discussion that we'll have now, we'll do a complementary review of the literature on this topic of the role of mental health in attaining well-being, in order to have a more rounded up base to produce a paper that hopefully all of us will be willing to co-author and to submit to the World Social Psychiatry Journal for publication. So I will ask the colleagues who are willing to support us with the projection of the slides to start, and then we'll introduce ourselves as listed in the program of this panel. Can we see the slides? Can you show the first one, please?
By the time slide is being ready, I think we can go ahead with the introductions. Oh, shall I introduce myself? I will ask Professor Khandelwal to introduce.
You have already introduced. Juan, namaste from Chandigarh, India. I am Sudhir Khandelwal, and we are all ready for this, as you have said, focus group discussion on the importance of mental health as part of general well-being. Thank you very much, Juan, for organizing this and making us part of this.
So this well-being and mental health topic interested me so much, so I readily joined the invitation by Professor Mezzich, and thank you very much for that. I am myself Dr. Varghese Punnoose. I am Professor of Psychiatry at Government Medical College, Kottayam, Kerala, the southern part of India, and also I am holding the post of Secretary General of Indian Association for Social Psychiatry. Thank you.
Well, thank you very much for, but can we do it along with the presentation of the slides? Yeah, if you can do that, that would be best. And then, along with the presentation of the slides, we'll see the list of the panelists, and then we can introduce ourselves in the order listed there.
Doesn't matter.
It is always a last resource of my reading the slides for you. But it would be much better if we can have also a visual presentation of the slides.
It's being arranged. It will take 1 minute. By the time,
Okay.
maybe you can
Okay.
make an introduction.
Well, perhaps we can remember that those who have the fortune to be in Chandigarh itself, they will be just under the Himalayas, and not the Himalayas being high are not as high as Narendra Week. And we had the opportunity with Srinivasa Murthy, who is also a member of this panel, to visit a good number of years ago and to be received by Narendra Week with his warmth and wisdom, and to have a wonderful day to review the main challenges of mental health.
Now
So
the
thank
slide
you
has
very
come
much.
up.
Great.
It
Thank
has
you
come
very
up.
much, Roy, for this. And so, well, it's very nice that Roy is helping us as well, in addition to Professor Basu, and as Roy was the one who introduced me to the world of the Association of Social Psychiatry, and we're starting a trip that so the topic, as already mentioned, is to examine in a couple of ways what would be the role of mental health in order to attain general well-being. Next, please.
Next.
Yeah. Okay. So here, let me use this list of the panelists, which include 5 colleagues from India and 7 colleagues from outside India. I will read the names, and then I will, along with that, invite each to show themselves, if possible, and to say a word, literally only for about 30 seconds, about their place of residence and their perspectives, and then we move to the next one. So the first is Roy Kajibayalil, eminent colleague from India, and from the world. So go ahead, Roy, if you could introduce yourself.
Yeah, I am a professor of psychiatry in Kerala, India. I am a former president of the Indian Psychiatric Society and former president of the World Association for Social Psychiatry. And I have also been Secretary General of the WPA from 2014 2020. I deem it an honor to work with Juan in the International College of Person-Centered Medicine. Thank you.
Thank you very much, Roy. And now also we have in the panel Sudhir Khandelwal from India. I met him in New Delhi many years ago, and I was very impressed with his wisdom and his hospitality. I'm very happy that he accepted to participate in this panel. Sudhir, could you say a word about to present yourself?
Yeah, certainly, Juan. I'm Sudhir Khandelwal. I'm a Delhi-based psychiatrist, and currently I work in Holy Family Hospital, New Delhi. Thank you.
Thank you very much. And then the man who accompanied me to Chandigarh, after accompanying the whole executive committee of the World Psychiatric Association to one of the regional meetings we had in India, Professor Srinivasa Murthy from Bangalore. Srinivasa, could you present yourself?
Thank you very much. I am Professor Srinivasa Murthy from Bangalore. Following retirement, I am working on mental health and well-being of people with cancer and HIV and caregivers. So that way, this is a very, very timely activity. Thank you very much.
Thank you. Next is Professor Shridhar Sharma, whose wisdom continues to accompany and illuminate us from New Delhi. Shridhar, could you present yourself? Well, I'm not sure that he's connected.
Maybe he's not
He may
here.
not be connected, but he's
He may be
always
online.
with us through one statement that
Yeah.
he made. Oh, hello, Professor Sharma. Could you present yourself?
Yes, I'm from New Delhi. I'm currently the Emeritus Professor of the National Academy of Medical Sciences. And I have more than 60 years experience in the field of psychiatry. I have hold many positions in both in national and international organizations. Thank you.
Thank you. Then we have Professor Punnoose Varghese from India. I met him along with Roy Kayivayalil. Very happy that he's joining us.
Thank you, sir.
Introduce yourself. Go ahead, please.
Yeah, I am Dr. Varghese Punnoose. I am a professor of psychiatry at Government Medical College, Kottayam, Kerala, the southernmost part of India. And currently I am the Secretary General of Indian Association for Social Psychiatry. Thank you.
Thank you. And now we have the contingent from outside India and alphabetically ordered. First, Professor Marijana Prash from Zagreb, Croatia. Marijana, are you there? Marijana is residing in Zagreb, which is, as you know, the city where Andrija Stampar, the first president of the World Health Assembly, comes from, and he not only coined the current definition of health that we all learn in the school, and is still quite valid. And I think it is mainly valid because it focuses on positive health rather than ill health. And
Marijana sent us an email saying she's unable to join.
Okay, thank you very much. So I am introducing her through a very important leader of Croatia that she has helped to promote, also because he was one of the first promoters of person-centered care, linking person-centered care to positive health. So we're delighted that Marijana has sent her contributions to this panel. Next, we have George Chistodoulou from Greece, who doesn't need any introduction. And so we're delighted that my friend George is joining us. Could you say a word about yourself, George?
Yes, with pleasure. Good morning, colleagues. It's a great pleasure to participate in this meeting. I'm George Chistodoulou. I'm Professor Emeritus of Psychiatry at the University of Athens. And also I'm the President-elect of the European Association of Professors Emeriti and President of the Society of Preventive Psychiatry. I've been in the board of the WPA, and I've been the President of the World Federation for Mental Health. And I'm interested in prevention and mental health promotion. That's all from me. Thank you very much.
Thank you. We also have as a contributor a psychologist that is one of the most important psychologists from Russia, Maya Kulygina, who is additionally a wonderful organizer of psychiatric events. And she's traveling outside Moscow right now, and therefore she didn't think that she was going to be able to connect. But she kindly contributed with her perspectives to this panel. So presume that she's not with us at this moment, but I'm sure that she's in spirit with us because she has maintained correspondence as we have been shaping the program. So we welcome very much and thank Maya for her participation in this event. Next is David Ndetei from Kenya, a legendary figure from African psychiatry and from the world. editor of one of the most important new books on African mental health. So we're delighted that he's part of this panel. David, are you there? Could you say a word about yourself?
Yeah, Juan, I'm very much here and looking forward to fruitful discussion. I am a professor psychiatry at the University of Nairobi. I direct the African Mental Health Research and Training Foundation in Kenya, and also the WPA Collaborating Center for Research Training in Kenya.
Thank you very much, David. Next, we have a psychologist from Germany, Margit Schmolke, who is currently the director of the Institute for Dynamic Psychiatry in Munich, and who has inspired the development of person-centered medicine from its very beginning. And we are delighted that she's able to participate, although I don't think that she's connected because of professional commitments. So we're very much welcome her perspectives. Next, we have Professor Werdie van Stadan from Pretoria, Nelson Mandela Professor of Philosophy and Psychiatry. And so we're delighted that he is illuminating this panel with his wisdom. Would you say a word about yourself, Werdie?
Good afternoon, colleagues. It's great to participate in this panel. As Juan has said, I'm at the University of Pretoria as a professor of philosophy and psychiatry in South Africa. I'm the co-chair of the WPA's section for philosophy and humanities and psychiatry, and the board member of the International College of Person-Centered Medicine. Looking forward to this panel discussion. Thank you, Juan.
Thank you very much, Werdie. And we'll also be happy to contribute my own perspectives to this panel. And so when that completes a group of 12 people who were invited and all agreed to participate in this exercise and excursion to try to together clarify what could be the role of mental health in attaining general well-being. So can we have the next slide, please?
Next slide. Next slide.
Yeah, can we have the next slide, please? This will review in a very simplified manner the perspectives that the group of panelists offered about 4 questions that were formulated for them. The first question was on what would be the conceptual place of mental health in general well-being. And our 5 colleagues from India offered their comments in a way that I would summarize, perhaps not making full justice to their depth and richness. This way, Roy Caribalil referred to mental health is a very important but underappreciated component of health policies. Sudhir Khandelwal talk about the mental health as essential component of well-being. Professor Murthy, mental health as vital, dynamically vital for well-being. Professor Sharma about mental health as part of any healthcare program. And Professor Punnoose that mental health is a common, usually recognized determinant of well-being. So there are all these perspectives that focus on the centrality of mental health about general well-being. Next, please. The next slide will present the summarized responses from the 7 panelists from outside India. Marijana Brash referred to mental health as crucial and foundational for general well-being. Professor Chistodoulou about mental health as a key component of well-being. Maya Kulygina, as mental health care is a key condition for general well-being. Professor Ndetei, mental health is critical for well-being. Margit Schmolke, physical and mental health are integral to general and individual well-being, no? Reminding us that well-being is a multidimensional concept that has not only mental health, but other ones such as physical components. Professor Van Staden referred to mental health as necessary, but not sufficient. This very precise conceptual delineation for general well-being. And I refer to mental health as a core component of general well-being. So I think that we can see the variety of perspectives that very much all of them recognizing the centrality of mental health in a multidimensional map of general well-being or quality of life. So that was the first question. The second one referred to the main mental health issues that additionally impact on general well-being. Next, please. Here, the perspectives from India include from Roy that such mental health issues that additionally have been affecting general well-being include depression, anxiety, and adjustment and stress disorders. Professor Khandelwal, mental health, chronic disorders, and the consequences of psychotropic medication, important factors to consider. Professor Murthy referred to the positive connections between mental health and well-being, namely recovery, coping, happiness, resilience, post-traumatic growth, creativity, acceptance, and integration. Professor Sharma referred particularly as significant mental health issues, poverty, and deficient education. And finally, Professor Varghese referred to how bad mental health practice affects well-being. Next, we'll have the summarized views from the international members of the panel. Marijana Brash spoke about depression, anxiety, and substance abuse disorders as the most prominent ones impacting on well-being. George Chistodoulou on psychopathology in general, so refer to the variety of mental health syndromes. Maya Kulygina to negative thinking, emotional dysregulation, stress vulnerability, lack of coping resources, and trauma. Professor Ndetei to depression, anxiety, psychosis, and cognitive deficits. Margit Schmolke to mental health problems which have a strong impact on general well-being and consequently on health behavior. Werdie Van Staden to illnesses as one of the important mental health issues impacting on general well-being, along with adverse life events, hardships of living, and lack of opportunities in general. And then I refer to depression, anxiety, stress, violence, and poor communication. Well, we can see a variety of issues that have been listed, including particularly in terms of frequency, some mental health syndromes around the most common ones, particularly depression and anxiety, and along with other factors that refers to the contextual environment of the of mental health that also can impact on general well-being. Then the third question was what Now, more specifically connected to the experience that we're still living of the COVID-19, what kind of mental health problems in this period are impacting on general well-being? And of course, from India, mentioned behavioral addiction. The first one, Roy Kaivailil, behavioral addiction, depression, and adjustment problems. Currently. Sudhir Khandelwal about mental health isolation, inactivity, overweight, socioeconomic issues. Professor Murthy to uncertainty, grief and loss, and loneliness. Professor Sharma to weaknesses in the health structures, presume health system structures. And Professor Varghese, problems in children impacting their later well-being. This is something that is increasingly being recognized, the importance of the early years to determine, to some extent, the course of life of people. Next, please. We'll have the international perspectives. Marijana Brash spoke about the post-COVID mental syndrome and the mental problems of health professionals, along with loneliness, mood adjustment, and addiction disorders. Then George Chistodoulou spoke about COVID as having a negative effect on well-being, and on the other hand, vaccination having a positive effect. And Maya Kulygina about distress, pessimistic or panic feelings, fear of contamination, obsessions or compulsions, health anxiety, and suicidal thoughts. Professor Ndetei about depression, anxiety, and suicidality. Margit Schmolke about pre-existing mental health issues which have been aggravated by COVID-19, especially because of prescribed isolation. In fact, it's been recognized in Lancet, this loneliness as the new, very important factor associated with COVID-19. And Professor Van Stadan about the vulnerabilities concerning disease, social isolation, and loneliness. And I refer more especially to isolation and fears. Okay, so we have also a diversity of perspectives, but all around mainly depression, anxiety, in terms of syndromes, but also other important factors such as loneliness and fears and violence related to this current period we are facing of COVID-19. Next, we'll see the question, which instead of asking for kind of a diagnosis of the situation, it looks for positive ways to for mental health to contribute to enhancing general well-being. So next, please. For the first and last question, we have as the perspectives from India the following. From Roy Kaivailil, increased investment in mental health has been one of the ways to try to improve general well-being. Also, anti-stigma campaigns and advocacy and health coverage efforts. So, referring to mainly public health ways in which mental health can contribute to general well-being. Then Sudhir Khandelwal spoke about sleep hygiene, healthy diet, avoiding alcohol and tobacco, and physical exercise. And so broadening this, not only mental health, but other aspects that are important also to contribute to general well-being. Then Professor Murthy referred to lifestyle, hope, mutuality for the individual, cohesion, support, values, communication for families, support, cohesion, and purpose for communities, and humanity and equality in regard to state and government policies. Professor Sharma spoke about promoting the value of mental health, promoting the quality of services and social supports. That's important to be considered. And Professor Verghese about governments that should adopt public health approaches and methods to enhance general well-being. Well, very interesting, mainly social and public health perspectives through which mental health can impact on general well-being. Next, please. The last group of responses refer to the international ones for this last fourth question. And here, Marina Brash spoke about the need for a world campaign in where we can emphasize again that there is no health without mental health, as Professor Brundtland mentioned this many years ago. And then mental health professionals in all healthcare teams should be assured. And also addressing the growing mental health disorders that have a continuous presence. Then George Chistodoulou spoke about the importance of well-being therapy of Professor Fava. It's a very interesting new approach to therapy that can be very relevant to kind of a person-centered approach to care. And also vaccination and other protective measures are important to consider. Then Maya Kulygina about psychoeducational festivals as one way to promote general well-being from a mental health viewpoint. Festivals that include seminars, psychological help, and clinicians' consultation. Professor Ndetei spoke about the dialogue with all stakeholders and policymakers, service consumers, care providers, and family and community levels. It's very important elaboration on the trialogal model for communication that our colleagues from Vienna have advanced, particularly Michaela Abering. And then Margit Schmolke spoke about mental health actions that should consider the patient as a person with emotional and social needs, being part of a family and a community, and having a specific life history. A broad concept of the person, contextualized cross-sectionally and longitudinally, to be able to enhance or engage all the important aspects of mental health to contribute to general well-being. Professor Van Staden spoke about the pursuit of practical flourishing and interpersonal and transcultural sensitivity and responsiveness on values awareness and recognition, on empathy training, and parental guidance and support. Here, as other colleagues have said, looking at these various aspects of the individual world, the social world, including family, and broader public government international perspectives. And my own perspectives focus on the value of social engagement and communication training. Okay, well, these were the summary that it was my own poor way of appreciating the important perspectives offered by all the panelists. And now, before listening to the comments that each one of them will offer, we'll have a little attempt to appreciate the higher level ideas that underline these more specific comments, so that to have a bit more summarized perspectives on each in response to each one of the four questions. So the next slide, we have the last four slides, 4 or 5 slides. Here we have that the main response patterns regarding conceptual place of mental health in general well-being would include that mental health is essential, vital for general well-being. Different terms can be used to describe both the foundational importance as well as the energetic, dynamic significance of mental health for well-being. At the same time, recognizing, as Professor Werdie by Stadan pointedly indicated, that, however, mental health is not sufficient for general well-being, because general well-being is a multidimensional concept and includes many other elements, physical, social, spiritual, ecological, etc. And that also mentioned by several colleagues were that mental health is often underappreciated. I think Roy Ibaril pointedly referred to this. So these were some of the, I would say, hierarchical concepts underlying the more specific ones that were offered by the 12 panelists, as poorly interpreted by myself, and hopefully could be enhanced through the comments now and through then the discussion that will take place also after this event to produce the paper. The next one will be the main response patterns regarding main mental health issues traditionally affecting general well-being. And here first we have a group of psychopathological syndromes, such as depression, anxiety, adjustment and stress, and substance abuse disorders, psychosis also, general psychopathology, just to make sure that we do not forget the variety of forms of psychopathology, and particularly chronic disorders. Then also another group of such issues include poor communication, cognitive deficits, negative thinking, emotional dysregulation, traumas, and lack of coping, which I think very important to point out that mental health is not only the absence of mental disorders, but having also a number of other dispositions and abilities to be able to fulfill our human responsibilities and opportunities more fully. And a third group would include bad mental health practices, side effects of psychotropic medication, for example. And then finally, violence, adverse life events, hardships of living, lack of general opportunities, to refer to these broader additional aspects in which mental health could affect well-being. Now, concerning the major responses patterns regarding mental health issues traditionally affecting general well-being, we have first depression, anxiety, adjustment disorders, substance abuse, psychosis, general psychopathology, and chronic disorders. Well, we have just reviewed this one. The next one, please. The next slide.
Okay.
Yeah, this one. Yeah, this is the concerning the third question. Was the major response patterns regarding the COVID-19 distinctive mental health problems impacting general well-being. And a summary of hierarchical ideas here could include increased rates of depression, anxiety, they have doubled basically, and also adjustments or stress disorders, addiction disorders are increasingly prominent, as we know, across the world, and suicidality. Also, another correspond to developmental problems, particularly adolescence problems. A third one refers to uncertainties, fears, violence, loneliness. So not disorders, but mental health issues that are very prominent. And then other aspects of the human condition, such as inactivity and obesity, often related to the COVID-19 period, and other socioeconomic problems related to the difficulties of people being able to fulfill their many needs, and then burnout of mental health professionals. So to remember that the person is also referring to mental health professionals and other health professionals, and the burnout experience that many of our colleagues have experienced in response to COVID-19. And finally, the weak and sometimes abusive health systems that also need to be considered. It's not only the individual world, but the whole contextual institutional world that has responsibility to deal with this. And the last question referred to in which ways mental health could enhance general well-being. So the next slide will present that in two views. Next, please. Here, we have at the individual level, a healthy diet, physical exercise, adequate rest and sleep, participative and creative activities as one set of actions. And another one deals with training on empathy, cultural awareness and responsiveness, and promotion of hope and flourishing, and the management of violence. And also person-centered and contextualized care and well-being therapy. So this is new more recent perspectives that have been offered in terms of forms of therapy that are particularly relevant to this person-centered approach to these issues. And then anti-infection vaccination and protective measures, which are very relevant to the world of pandemics that we are experiencing and probably will continue experiencing. Now, at the second level, at the family level, we have proposals for enhancing promotion of cohesion, purpose, and support, and especially parental guidance and support. At the social level, it has been proposed by several of the panelists, dialogue among the stakeholders, psychoeducational festivals and seminars and clinical consultations, and the promotion of mutuality, or intercare, as some people refer to, and effective communication and solidarity. And this last group of responses also have in the next slide the two more elements or two more levels to consider. Here at the government level, it has been proposed anti-stigma campaigns, increased investment in mental health services, insertion of mental health professionals in all healthcare teams, and constitutional legal promotion of well-being of all people as the main responsibility of a government, particularly the more vulnerable. And this we have seen recent very inspiring examples from New Zealand here. Well, at the international level, we have mental health and well-being campaigns, the reiteration of the Brundtland motto of no health without mental health, and finally, including person-centered approaches in humanitarian efforts and many other efforts, which are, as we are speaking, emerging as an important considerations by the Red Cross and similar important international organizations. So, so these are a summary of what we have for eminent panelists, and so after this summary, I would like to offer to all the panelists an opportunity to comment briefly on what the whole group has said. So ideally using a minute or less for doing this, just a few, half a minute perhaps. So if we look at the, I will mention the names. First, Roy Kayivayalil, do you have any comments to offer to these views and recommendations?
I will surely say that we should promote that there is no health without mental health. Thank you.
Thank you very much. Sudhir, Khandelwal, any comments to
Juan,
this?
Juan, you have already summarized it. And I think it's quite comprehensive and nothing more to add to it. Thank you.
Thank you very much. Professor Murthy, any comments to this summary?
Yeah. Very, very briefly, I am deeply appreciative of your commitment to personalized medicine. And I want to recommend to the group 2 books which have come out recently. One is Personalized Medicine, other one is Personalized Psychiatry. 2 excellent books. And in the context of our topic, public mental health, there are 3 components: for the people, by the people, of the people. Mental health and well-being touches upon by the people and of the people, a much needed shift from for the people. Thank you very much.
Thank you very much. Then Professor Sharma, any comments to this summary?
No, you have done excellent job. I would just say mental health is a part of the total health. It's not apart from the health. That is the basic thing. The second is that we must reshape the physical, social, and environmental factors to reinforce the mental health. You know, that there is a need for strengthening the existing infrastructure, because that is lacking, because that is implementable, possible. So these are the few comments which I thought.
Thank you very much. And then Punnoose Varghese, any comments?
Yeah, I hope and wish that a day will come when the mental health and well-being would be considered as the main criteria or index of development of a nation. So at a global perspective.
Thank you very much. Marijana Brash is not with us, connected at this moment, so cannot offer additional comments. And so this will then bring us to George Chistodoulou. Any comments, George? To your microphone. Sorry, George, your microphone is closed.
I'm sorry, I put it off, not disrupt you, because there is a dog here, my dog, which is making various noises of various qualities. So my only comment is to thank you very much for this excellent summary, Juan. Thank you very much. I don't have any further points to raise.
Thank you very much, George. Well, Maya Kulygina, I think, is outside Moscow and doesn't have access to internet at this moment. And then Professor Ndetei from Kenya.
Yes.
Any comments, David?
Yeah. Thank you very much for a wonderful job in preparing for this. Listening to all the inputs, I think they are all saying one thing in different words: no health without mental health. And I think that is what we are all saying. Thank you.
Thank you very much. Margit Schmolke also is not available, is not connected. So we'll have the opportunity to listen to Werdie van Staden. Any comments?
Thank you, Juan. I would like to make 2 comments. And the one is really just something which we have not touched on. I like the very broad scope of our endeavors here, but something I think I would like to see and unpacked a bit further is this statement: no health without mental health. It's got a side to it which I think we have not addressed to it, and that is that any illness, whether mental or bodily illness, invariably has an impact on mental health. Whether I've got the flu, it has an effect on my mental health. And it's just that kind of thing, that kind of perspective, that kind of direction of a causal influence, which I think should also acknowledge in that saying. So that's the first comment I would like to make. And the second comment is about the actions for increased well-being. And Juan, I really like the levels that you've articulated there, because that occurred to me immediately that we will have to differentiate between the levels. But I would like to link those levels with David Ndetei's highlighting of stakeholders, and that there are various stakeholders to these levels. And that's really important to make those stakeholders explicit, so that we can induce ownership and agency for those actions. Thank you.
Right. Thank you very much. I think your last point not only recognizes an important level, the stakeholders, but also the importance of dialogue among them to try to bring understanding of these different perspectives. So that instead of conflict, we could have collaboration and solidarity exercise to be able to have everybody contribute to both mental health pointedly, but also to general well-being, which is another way of speaking about health and quality of life. So thank you very much for these very valuable comments. We shall have the opportunity to have further comments and reflection through the exchange that we will have in the next weeks to try to bring this discussion to the literature, complemented by a selective review of the literature to amplify it to some extent. So with all of that, I like to thank all of you for the efforts that you made in responding on time to my request for summary perspectives, and then to come to these opportunities to celebrate Chandigarh and Narendra Week and all what is wonderful from India. So we'll have now just the opportunity to say goodbye, and like to give an opportunity to each one of us to say so, to finish this way the session. Any final word, Roy?
Nothing. No. Thank you. Nothing else.
Thank you.
Thank you. Thank you for the leadership.
Thank you very much. And Sudhir Khandelwal?
No, thank you for doing very excellent job.